Many times after waking up in the morning or sitting for a long time, the knee becomes stiff and develops a clicking sound, and usually also associated with pain, and felt in the front part of the knee or behind the kneecap. So this is what the topic I'm going to talk to you in this particular video. Forget about the medical terminology, Chondromalacia Patella. What is important to you is how does it manifest in our body. So what is Chondromalacia Patella? What are its causes? What are its symptoms? We will be talking about its prevention and its treatment, how it can be addressed. So stay tuned till last in this particular video. Chondromalacia Patella, also known as runner's knee, is a condition in which the cartilage under the kneecap, the patella bone, softens and becomes damaged. This cartilage acts as a natural shock absorber, helping the knee to move smoothly. When it is damaged, it can cause pain, swelling, and decreased range of motion. And in this particular entity, Chondromalacia Patella, there is a reduction in the articular growth beneath the patella, which can lead to poor traction on bone surfaces and result in knee pain. And that's particularly anterior knee pain. This is due to the increased contact of bone and chondromalacia, the damaged surface of the patella. So even after sitting or standing for a long time, and there may be a pain in the knees because of this particular reason. So what are the causes of Chondromalacia Patella? The knee injury. Number one is knee injury. A direct blow to the knee, such as a fall or a sports injury, can damage the cartilage beneath the patella. Overuse. Second is overuse. Repeated use of the knee, such as running, jumping, or activities that involve bending the knee, involving a lot of on the rough surfaces, involving the wear away of the cartilage, can result in such mechanisms. The third mechanism of developing this particular entity is abnormal alignment. If the knee joint is not properly aligned, the patella can rub against the bone, and this incorrect alignment damages the cartilage further. So this is one very important mechanism because of which the runners do face this particular problem. The fourth mechanism is muscle weakness. These are all the common conditions because of which people do face this particular problem. So weak thigh muscles may not help the patella to track properly, which can damage the cartilage. The other associated medical conditions, some very common medical conditions are, as such, knee joint can get affected in any of the systemic illnesses in the body. What are the common those conditions are? Rheumatoid arthritis, rheumatism, osteoporosis, can also risk development of Chondromalacia Patella. Now, this particular Chondromalacia Patella is also a problem resulting with age. Supposing if you have never been running till 40 years of age and all of a sudden you decide to start running, and that too 10 kilometers, 20 kilometers, marathon running. Now this is how you are going to land up in trouble because your muscles are not that strong enough. So age is one of the factors which one has to take into consideration. If you have been athlete since your childhood days, since your young school-going age days, then it's perfectly fine. Then this will not bother. Women are more likely to get affected with Chondromalacia Patella as their muscles are relatively much more weaker as compared to males. Overweight. Overweight is another one situation. Being overweight puts extra pressure on the knee joints, which can increase the risk of cartilage damage, right? So the next important point is lifestyle. People who are not active or who sit for very long hours Many times I come across many patients in my clinic, my day-to-day practice, those who say, once I start my work, I do not get up before 8 hours. I don't get time even to go to washroom even. So these are people who are very likely to develop these kind of problems. And these problems are kind of symptoms. So let's understand now what are the symptoms of Chondromalacia Patella. Number one is knee pain. Knee pain usually is felt in the front part of the knee, behind the kneecap. And usually the people will indicate that all around the knee is painful in the front part of the knee, right? And it can get worse during or after activity. Next important symptom is swelling. The knee may feel swollen and feel little warm as compared to the other side. The third important symptom is stiffness. The knee may be stiff in the morning or after sitting for a prolonged period of time. Third important symptom is crepitus or grinding. When you roll the patella over the surface of the thigh bone, this surface gets affected. This is that surface which gets affected. This is the surface which is having the cartilage, and when it gets affected because of the sitting position, prolonged sitting positions or running, all these things gets affected. So crepitus is one symptom, also goes in favor of you feel crack, 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 crack sound you get, right? So let's talk about the prevention of Chondromalacia Patella. Strengthening your muscles. The same point I have discussed earlier in my osteoarthritis knee problem also. The strengthening of the muscles, strengthening the quadriceps group of muscles. This thigh group of muscles is called quadriceps. The quadriceps muscle strengthening will help a lot to address this particular entity. Regular exercises, especially knee strengthening exercises, can help to risk to development of Chondromalacia Patella. Next important point is control your body weight. Excessive weight can increase the frequency of manifestation of problems because of Chondromalacia, increasing the risk of the damage to the cartilage. So the focus should be on losing body weight and maintaining it as close to normal as much as possible. Use proper techniques. Using proper techniques of running, get a proper training. If you want to participate in marathon, there's nothing wrong in having that desire, but get yourself trained under the expert's guidance. Not suddenly that I want to do it and you start doing it. So that will help to prevent your injuries. And finally, the most important thing is to listen to your own body. Listen to the body's signals. Body will always give you signals. And if you feel pain in your knee, stop that activity and take rest. Continuing the activity will increase the problem further. Continuing the activity despite experiencing the pain can make the injury worse. So this is what we are not supposed to do at all. Just take care of this particular thing, right? Well, let's discuss what treatment. What is that? What you can do?
Well, diagnosis is mainly on the clinical grounds, but while coming to the radiology, we need to get this particular kind of view done. Skyline view is very, very important to diagnose Chondromalacia Patella, and any X-ray for the knee must include AP, lateral and skyline view. These are the findings we can get, and we reach to a better conclusion. Without this skyline view, it is very difficult to diagnose Chondromalacia Patella or a runner's knee. So that is why it is very, very important for reaching to better and clinical radiological diagnosis.
What you can do before approaching a doctor, before approaching a orthopedic surgeon, before approaching a rheumatologist or physicians, because these are the three professionals you might be consulting for this particular problem. Number one is rest. Resting from activities that aggravate the pain in the knee, it is the first step in the treatment. Like I always advise my patients not to do kneeling, not to do cross-leg sitting, and not to do squatting. Squatting means the way we sit in Indian toilet system. Next important thing is use of ice. Ice fermentation can reduce the swelling and the pain. How to do ice fermentation? You can check the link, ice and hot fermentation, cold and hot fermentation. I have already done a video on that. You can watch that particular video. Next is compression. Wrapping the knee can help to reduce swelling. Knee braces are available. One can make use of that. Next important treatment what needed is to do elevation. Elevating the knee above the level of the heart can help to reduce swelling. Next important treatment, which is advised by your orthopedic surgeon or your rheumatologist or by physicians, is pain medications. Over-the-counter pain medications also you can take it from the pharmacies, and the chemists are dispensing, and that is the best medication is using paracetamol for that. Paracetamol can be taken up to 500 milligrams 3 times a day. 500 to 650 milligrams 3 times a day can be taken for this particular problem. Rest of the medications are all to be prescribed by your physicians and by your orthopedic surgeons or by your rheumatologist. Then they know this thing much better, what is the best suited for your body. So next important thing is to consult a physiotherapist. Physiotherapist can guide you, can train you to help you to strengthen your thigh muscles, help you to strengthen your quadriceps and hamstring group of muscles. Static quadriceps exercise is also very important. One video I have already done, you can find again in the link here, that is the do's and don'ts with the knee pain and those exercises what is recommended for the knee pain, how to strengthen the muscles. Once your pain gets controlled by medications, you should start doing those exercises, right? Well, one more point I would like to add here before I conclude this video is that for those who are runners, as I said, this is also called a runner's knee. For them, it is highly recommended to wear a good quality shoe for your running or jogging, or for those who are 45, 50 plus, for them walking is good enough. They should be wearing a well-fitting sneakers or well-fitting shoes which will help them to reduce the incidence of this problem. Because every time when you experience this kind of pain, you feel more disheartened and you stop doing that activity. Activity doing, there's nothing wrong in it. You have to be physically active, but when these kind of experiences happen more frequently, you stop doing that activity. So, more importantly, that you should use excellent quality shoes. If that shoe becomes worn out, better replace it. So this is very important. Make sure that you are using shoes. A lot of people recommend barefoot running, barefoot walking. For a short distances is okay, but long distances, if you're doing it, it's not a good idea. And particularly if you have intentions to participate in marathon, or even if you're doing it for your own fitness purpose, excellent quality shoe is very, very important. Don't forget this part. Of course, for my Hindi viewers, I might dub that video in Hindi. And sorry, long time that work is pending in spite of repeated and regular demands from my Hindi speaking patients. But yes, good number of videos already have been done by me before in the knee joint, knee pain playlist. Now, I request you to go through all those videos. You will definitely get a good insight in addressing this particular problem. Right? Thank you very much. Bye-bye. Take care. And do let me know if you have any more concerns in your knee, or what other good topic you expect me to talk about. We can discuss about that. Thank you very much. Bye-bye. See you in the next video. Please make sure that you share it. Don't forget to hit the like button if you have liked it, and hit on the bell icon. Thank you very much. Bye-bye. See you in the next video.